Last night, I was woken up by the ward nurses telling me that the patient had fever and I couldn't sleep after that. Do I have eye bags now? Do I have dark eye circles? Today, we're going to talk about these two topics, dark eye circles and eye bags. I'm Dr. Peter Chung, consultant dermatologist. Before we start, let us bust some myths about dark eye circles and eye bags. So I'm going to start off with some questions, and then we'll let Dr. Chai and Dr. Loo to decide whether it's true or false. So first question, dark eye circles equals to lack of sleep.
I think that's not the sole reason. There are many other factors.
Other factors like genetics, aging, stress, and so on, which we discuss later.
Yeah, okay. The second question, rubbing your eyes can make your dark eye circle worse.
Rubbing eyes can cause blood vessels fragility and tendency to break, which can accentuate the visible blood vessels underneath your skin.
Yeah. Also, crying a lot make it worse.
Yeah. Also, we have patients with eczema. From young, they have eczema and then they keep on rubbing their eyes. So you'll see that the texture of the skin has become wrinkled. Instead of smooth skin, it becomes wrinkled and also it becomes darker. So we always want to treat eczema around the eyes early on, rather than have these permanent complications due to the eczema. Third question, too much screen time can make the dark eye circle worse. True. Why do you think so?
I think because eye fatigue can lead to dilatation of the blood vessels underneath your eye, which can cause it to appear more visible.
Also, more screen time, lack of sleep, and then burn the midnight oil, and then you got the dark eye circle. Vicious cycle.
Now let's move on to eye bags. Does aging leads to eye bags? Yes.
Aging actually causes reduced elasticity of the skin, and then causing the sagginess and also the eye bag.
Lastly, if my parents have eye bags, I'm sure going to get eye bags. Is that true or false? So we have a differing opinion here, right? Dr. Loo, why do you say yes?
Yeah, I think genetic plays a part as well. A lot of our patients, their parents have eye bag, they also have it. But it's not the 100%, but it increased the tendency of having the eye bag.
Yes. That's what I thought also. That's why
okay.
it's not necessary that you
not
have it
100% sure.
Yeah. So it can be, and sometimes also you may not have family members who have eye bags, but yet you can have the eye bags. So now let's dive deeper into the causes of these dark eye circles. Right? For me, number one, we look at genetics. Some patients from young, they already have dark eye circles, right? Especially certain races, dark eyes, those with darker skin tone. In Malaysia, we have a lot of Indians, right? If you look at Indians per se, most of the time they have a deeper socket of the eyes, right? So the eyes actually go deeper, more posterior, we call it deep inside. So definitely you have a darker eye circles there among the Indians.
Yeah, okay. I think lack of sleep and also the screen time, increased screen time, both of them actually correlate to each other. Also lead to dark eye circle.
And just now we mentioned about allergies such as eczema under your eyes can cause the blood vessels under your eye to dilate, and further rubbing and scratching can irritate your skin and leads to the breakage of the capillary cells.
Yeah.
Because some patients will have more obvious vessels, right, under the eyes, right? So definitely for patients, even if the vessels didn't rupture, you can see the darkness around there, but it's actually due to multiple vessels around that area. Right?
All right, and not to forget UV damage, because increased UV damage can lead to increased melanin production, which will lead to hyperpigmentation underneath your eye too.
Yeah, aging itself also is a cause of dark eye circle.
Yeah, because of the shadowing, right? As the eye bags sags, so it's related. Eye bags with these dark eye circles, because as you have more eye bags, then you perceive to have some dark eye circles there. So besides aging and also genetic that we talk about that cause eye bags, I think another factor that we need to consider is the fluid retention, right? Especially like for me, if I were to drink lots of water, before I sleep, then early in the morning I will have that. So lots of fluid and also salt. Salt causes water retention as well. So I'll tell my patients, if you have that problem, then just try to avoid drinking too much before you sleep. Now, as for treatment of dark eye circles, right? Of course, it depends on what is the cause of the dark eye circles, right? Like genetic, sometimes I tell my patients, although I can lighten to a certain extent, but I know it will come back again, right? But for eczema, like I mentioned, it's something that we need to aggressively treat it. It's something that can be controlled. Although I cannot promise cure, but it definitely is something that can be controlled. Once your eczema is controlled, the pigmentation will lighten by itself. You don't need to treat. What about any other causes that we commonly treat?
The vessel underneath the eye, the one you can use vascular laser to actually lighten it. And also, if there's discoloration, we can always use pigment laser. And also, any laser to reduce the vessel around the area.
Other treatments like injectables, like PRP to stimulate collagen production, skin booster to hydrate your skin, or fillers to smooth out the skin and also increase volume.
Yeah, especially, we call it tear troughs, right? Some patients have volume deficit, and that creates also another shadowing there, as the patient has dark eye circles, but it's actually the shadow there. So once you fill up that area, then the dark eye circles becomes better, right? But we also have devices that helps to stimulate collagen. Right? Once you stimulate collagen, always the collagen is your normal color, what you're supposed to have, the skin color. So once you have collagen, you have more new cells there, then the skin also lightens. So example of devices that can be used, including lasers and also radiofrequency. But how frequent do we need to do all these procedures?
For laser, we can actually do every 2 weeks. If the patient get better, and then we can actually go monthly treatment. But it's going to be a long-term treatment.
Yeah, and for radiofrequency, we need to do once a month for 3 times to achieve the maximum effect. We cannot try to be too aggressive on the lower eyelid as well, because we know it is a very thin skin, very sensitive skin there. Anything too aggressive, you may even cause more pigmentation. Now, what about these eye bags? What are the options of treatment for eye bags?
For eye bag, it depends on severity. If let's say it's very severe, it's very difficult if you want to treat with laser or radiofrequency. The treatment of choice is actually surgical. I always tell my patient, if their eye bag is something like you're wearing the clothes, you're now thinned down to M size, previously you're L. So if no matter how you iron the clothes from L, you cannot get an M. You have to cut it and then sew it to smaller, the M, so you get better result as compared to just do a laser. But for milder cases, we can actually do device.
So I've received quite a number of referrals from the ophthalmologists as well. When the patient presented to them, and the ophthalmologists think that it's too mild for surgery, they also refer to us. So for us, nowadays for eye bags, if it's not too severe, my first choice would be actually using a fractional microneedling radiofrequency, because I can adjust the depths. Because where is my target? My target is the fat. My target is the skin. I'm not trying to shrink the muscles. So around the eye bags, the most you want to go is 2 millimeter. When you go 2 millimeter, you are at the fat layer. So when you heat up the fat, you actually contract the fat. So basically, you want to shrink down the size of the fat. And you can also go 1 millimeter to tighten the skin, to stimulate collagen around the skin. So that's how I treat eye bags, using devices. As for, just now we mentioned about fillers for pigmentation as well. Actually, if it's a very mild eye bags, we can also use fillers to improve because one is like a mountain, like a hill. And then if you have a volume deficit, you actually have a valley there. So now if you fill up the valley, the contrast becomes less. Your hill can become lower now. So you can imagine if a person have an eye bag there and then followed by a depression, a sunken in there. So what we do is we fill up the sunkenness and to flatten out the unevenness in terms of that height. What about creams or topicals, lotion or this eye cream? Some patients will think that, the thicker the eye cream, the better it is. What do you all think?
I think if you're applying things on the eye, periorbital, we have to be careful not to be too oily. Ointment based, usually we use gel based. Otherwise, you get a lot of oil seep around the eye. No matter lightening cream on the eye or the sunscreen on the eye.
I think another common mistake that people do is overzealous application of retinoids under the eye. So long-term application of strong retinoids can actually irritate your skin, and it can cause red and flaky rings under your eyes, which may turn darker when they heal.
Yeah, so it's a place where I totally avoid, the topical retinoids, whatever gel and everything, because it does, like Dr. Chai said, it causes dryness, sometimes it causes irritation. So a good tips there to avoid, topical retinoids around the eyes. Now, even sunscreen, I think it's very important as well, because, we always say sun is most of the time on top, right? So the UV rays shine onto your face, and your eye bags tends to be exposed most on that area. Sorry, your lower eyelid tends to expose that. So you need to actually put UV sunscreen at the area as well, around your eyes as well, in order to minimize these dark eye circles.
Some patients might be asking, does DIY hacks like cold spoon, tea bags, and cucumber works effectively to reduce dark eye circle?
I actually don't agree those remedies because I'm afraid of allergic reaction towards all this. Like probably they put lemon or whatever. Is easily get contact dermatitis.
Yeah.
To me, I think all these DIY hacks, they has temporary cooling and constricting vessels effect, but it doesn't last long.
So it also, whenever we put something on our skin, number one is we have to know how long to apply on it. A thing can be non-irritant, but if you leave it overnight, it's going to dry up the skin. When it dried up the skin, it can also cause eczema problem. Number two is the pH of the items that you are going to apply on. So of course, the more acidic it is, the more irritant it's going to cause, right? Like you mentioned about tea bags. It can be a lot of things in the tea bags, right? And we know it's most of the time acidic as well. So it's a bit dangerous to experiment it on your face. So that's why generally we don't recommend using all these home-based remedy. But what are the other ingredients that we can use to improve these dark eye circles? Right? For example, hyaluronic acid, we know is something to hydrate the skin. So when you hydrate well, the skin also brightens up. Number two is also things like arbutane, tranexamic acid. These are the ingredients that can be used to lighten the skin also. So if you're still having dark eye circles, despite having a good lifestyle, you have adequate regular sleep, you quit smoking, quit alcohol, and yet you're still suffering from dark eye circles, please seek advice from your doctors to find out what is the cause of your dark eye circles